Good evening. My name is Ismael Macala. So I'm a dual critical care nurse practitioner student. I'm gonna be conducting today, an assessment on you. I'm gonna make you a few questions. Okay. So this interview is gonna be videotaped. So that's okay with you if we videotape?
Sure.
So to start with the interview, I would like to know what is your name and your last name, please. Okay. What is your primary language?
Spanish.
Okay. What is your date of birth?
February 9, 1985.
Okay. And what is your actual age?
35.
35. Okay. Where were you born?
Cuba.
Okay. So are you single or married?
Married.
Very good. So and you're from Cuba, right?
Yeah.
What is your highest levels of education?
High school.
So what is your current occupation?
A dental assistant.
Okay. Do you have any insurance at the moment?
Yes, one.
What type of plan it is? Is it commercial? Is it
Commercial.
medical? Commercial? Okay. So what brings you today to the office?
Oh, actually, I came because I have like a heart pain or sharp pain here on the ankle on the back, and it's swollen.
Okay. So when this start?
Like a week ago, actually, but I noticed that it got worse. It didn't went away.
Okay, a week ago. Okay. So this pain, if you will give it a number from 1 to 10, being 1, minimum pain being 10, the highest pain that you have experienced, which number would you give it to the pain?
4.
A 4? Okay. So do you suffer any trauma to the area? Like you twist your ankle?
Not that I remember.
So how the pain started?
Actually, started work. I don't know. I was working the whole day, walking here and there in the office, and just started being painful.
So you started noticing there was. Does the pain move to an area? I mean, move to other area beside the ankle?
No, it's only in the same place.
Okay. So there is something that makes that pain worse
Yeah,
or better?
walking or actually worse, be walking all day.
Okay. And what can make it better?
When I rest,
When you rest. Is there any medication that you are taking for that?
Motrin,
Okay. How many milligrams do you remember?
like 400.
Okay. How many times a day you're taking that medication?
I don't know, when I have the pain, maybe like 2 or 3 times.
Okay. So on this pain, when it comes to you, how long it lasts?
Actually,
Is it pain that goes away right away, or is coming back and forth? How it is?
coming back and forth, goes away when I take the pain medication.
Okay. So what do you think about that pain? What it means to you?
I really don't know.
Okay. So I'm gonna continue. I'm gonna ask you a few more questions about your past medical history, surgical history, childhood. Is that okay with you?
Yeah.
Okay. So, do you have any major disease, any past medical history?
No.
Okay. I mean, you have been recently hospitalized.
No.
Okay. So, do you remember any childhood illness like chickenpox, measles, any sore throat? No. Do you have any surgical history that you are aware of?
No.
Okay. Have you been pregnant before?
Yes.
How many times?
2.
Okay. How many terms delivery?
1.
Any preterm baby? Preterm is when they born before time, I mean before 37 weeks.
No.
Okay. Any abortions?
Yes.
Spontaneous or induced?
Induced.
Okay. How many children do you have living?
1.
Okay. So what about immunizations? You get vaccines?
Yeah, they are up to them.
Okay. You got the flu shot last year?
Yes.
Do you remember the day?
It was like on October.
Okay. Any other recent vaccine that you have received?
I have the um, the injection or the one that they put for, can I say it?
For what?
To not to get pregnant.
Oh, but no, that's not a vaccine. I'm gonna get to that. I'm gonna get to that information later on. Thank you very much. So, do you have any, as a children, also as adult, any mental problem, any mental illness?
No.
Are you allergic to any medication,
No.
to any food, any product?
No.
No? Which medication are you taking currently? Besides the Motrin that you told me already, 400 milligrams? Okay. So you told me that you're using a medication for what? For pregnancy?
Mm-hmm.
You recall the name?
Medroxyprogesterone.
Medroxyprogesterone?
Yeah.
Okay. How many milligrams?
150.
Okay. So how is that given to you? That's
Once every 3 months.
once every 3 months, a shot, an
Injection.
injection? Okay. So you have you get recently any physical examination? You know, every year you get your regular physical exam?
Not from last year.
No?
Sorry.
So last year you didn't have the... So do you remember last time you got a general physical exam?
Like more than a year ago.
More than a year, you recall? Okay, over a year ago.
Mm-hmm.
Do you remember the last time you have a mammogram? Have you done a mammogram before?
No.
No? You remember if you have when was your last dental exam?
Like 2 weeks ago.
2 weeks ago? Okay. Do you do self-breast examination or no?
Yes.
When was the last time you did it?
Like a few months ago, maybe like 5 months ago.
5 months ago? So, you know that it's recommended to do this monthly, so you can keep an eye and check your breast. Do you see you have any lumps, any change of skin, if you have like secretion through your nipple?
Yeah.
Okay, so based on your family history, are your parents still alive?
Yes.
Okay. Do you know which disease your parents suffer from?
Have a heart attack.
Okay. You remember when was that?
2012.
Okay, 2012. Okay, what else?
My father have brain surgery.
Okay, when was that? And what, do you remember what it was?
Was a neuro. I don't remember the name. Was a tumor on the brain?
Okay, there is any other health conditions that they have?
No.
No? They don't suffer hypertension, diabetes,
High
thyroid
cholesterol.
problems? Who
My
suffer
father.
from high cholesterol?
My father.
Okay. Any other problem that you recall?
No.
No blood pressure, no diabetes, no thyroid problems? Okay. What about your mom? Just a heart attack in 2012, right?
Mm-hmm.
Okay. So, are you a resident in the United States? Are you a US citizen?
U.S. citizen.
Are you a citizen? Do you practice a religion?
No.
No? What is your perception about your health right now?
I mean, I feel very good. I mean, I don't think that I have any issue.
Okay.
I mean, beside that.
Beside the ankle? Okay. So do you, how is your appetite? Are you eating well?
Yeah.
Yeah? Have you noticed any changes in weight recently?
No, I'm very stable on my weight.
Okay. Your fluid intake, how is your fluid intake? You drink a lot of water, you don't drink water?
No, not really.
Not really, you know you should have at least a glass of water a day. You know, that will help you out to keep your body hydrated, you know, help you out with your urinary system. Do you remember your last bowel movement?
Like 2 days ago.
2 days ago. So how often you go to the bathroom? How is the stool? Is hard, is soft?
It's hard and very constipated.
Okay. Do you take any medication for this constipation problem? No?
No.
Okay. So how are you urinating? Any burning sensation or
No.
any like dripping, incontinence?
No.
No? Okay. So where do you live? Is it a house, apartment?
It's a house.
Okay. Is it a community? Is it a rural place or is it a city?
No, it's in the city.
Okay. So, do you know if you have any occupational health? So you told me you were like a dental assistant, right? So in your work you are exposed to any environmental toxins or maybe environmental factors that may affect your health?
Maybe radiation, but we get protected.
Okay. So do you have any problem doing your normal daily activities?
No.
No? You don't get tired, you don't have a... Okay. So what is your role in the family? How is your family composed?
My husband and my daughter.
Okay. Have you have noticed any problem with your memory, with your speech?
No.
No? Okay. How you sleep?
Very well.
Very well. Do you use any device to help you sleep at night?
No.
No? How many pillows do you use to sleep?
One.
One, okay. Do you exercise?
I'm not that good on that. Maybe once a week.
Okay, that's good. So it would be nice if you could increase your level of activity because that will decrease your sedentarism, you know, and they can help you to improve your health too. The recommendation is at least 30 minutes, 5 days a week to keep you, you know, running up and in good health condition. That would be a recommendation. So what is your preferred hobby? What you do to, I don't know, to recreate yourself or to relax? What would you prefer to do? What you like to do?
Go to the beach.
Beach,
Go out with the friends.
go out with friends. Okay. Do you smoke?
No.
Do you drink?
Yes, social.
Social drinking? Okay. How many drinks?
Maybe 2.
How many daily? Once a week?
No, just when we go out. I don't
Just
drink
when you
alcohol.
go out? Any drugs?
Yeah. No.
Okay. Have you any time suffered intimate partner violence?
No.
No? Do you feel that you are under stress at the moment? Are you coping well with stress and your daily life?
No, I'm doing good.
Doing good?
Doing good.
Alright. Are you sexually active?
Yes.
Yes. Are you having any problem with intercourse?
No.
No? Okay. Has noticed any change in your health function?
No.
Okay. Alright. So I'm just gonna make you a couple more questions and I think we're gonna be pretty much done. So as we mentioned, you haven't noticed any loss in weight, right? You feel like dizzy, weak? No? Any fever?
No.
Alright. So have you noticed any like a new rash on the skin, itchiness, you feel itchiness?
No.
Any change on the hair and your nails? Any changes?
No.
Something new?
No.
Have you have any head injury recently?
No.
No? Headaches? No? Nausea?
No.
Have you noticed any changes in vision?
No.
No? Any redness in your eyes? Any secretions?
No.
No? Have you noticed any changes in your hearing? Like a ringing in your ears? No? Problems with audition? Pain?
No.
Okay. Do you use any hearing aid?
No.
Okay. Have you noticed that you have any nosebleeds?
No.
No secretions? No? Okay. Any fever, allergies?
No.
Change on the smell? No? Okay. So have you noticed in your mouth, you have any like a mouth pain on the gums? You bleeding on the gums?
No, not really. I do my
No?
clinics like
So you keep up to date with your dental checkups? Okay. Do you have any sore throat? Dry mouth? No? Okay. On your neck, you have any problems with neck movement? How is your range of motions? Good?
good.
No pain? Have you noticed any lump on your neck?
No.
No? Any like inflammation, goiter, like swelling here? No?
No, not really.
Okay. So we mentioned your breast self-examination. Have you noticed any lump on your breast?
Not from the last time that I did it.
Okay. Any change in color?
No.
Secretions? Is there redness anywhere? What about in the area of the axilla?
No.
No? You haven't noticed anything there?
No.
Okay. So do you have any cough?
No.
You feel short
no.
of breath?
No.
No? Any lung problems?
No.
No? Like pain? No? Do you feel chest pain? Discomfort? Palpitations? Any like thrill, like if your heart is going too fast?
No.
No? Have you noticed swellings in your hands, on your feet?
No.
Okay. History of hypertension?
No.
Okay. So how you feel like recently? Loss of appetite? Nausea?
No.
Vomiting?
Only with my last pregnancy.
Just during the pregnancy. Okay. So what about change from the color of your skin? Have you seen like a yellowish coloration on the skin or here on your mucosas?
No.
No? So any diarrhea? Change on stool patterns?
No.
Still the same, like constipation?
Yeah.
Okay. Have you noticed any blood when you go to the bathroom?
No.
No? So how are you urinating?
Good.
Good? So no burning sensation, you don't feel that you have to hold,
No.
no leakage,
No.
right? So do you remember your last period, last menstrual period?
November 23.
November 23? Have you noticed any vaginal discharge? A bad odor?
No.
No? Okay. So do you know, so we talk about already birth control methods, so you are taking medroxyprogesterone 150 milligrams once every 3 months. That's what controls you use as a pregnancy protection, right?
Yeah.
So, so are you aware of the Kegel exercises? Or
Yeah,
especially
you're
for women that had a child already, so those exercises, what they do, you contract the pelvic floor muscles, and that help you like in the future, so you don't suffer from incontinence. So if you do, if you're aware of it, you should keep practicing them because it's a good exercise.
I do.
Okay, very good. So do you feel that your fingers or your foot they get cold, cyanotic, like bluish color?
Yes.
Okay. So how often this happens?
I noticed that like on winter actually, maybe December.
During winter time?
Yeah.
Okay. And how can you describe it, that, you know,
I don't know,
that
I
coldness
just
on the
was-
fingers?
Yeah. One finger was like a more white. I don't know. It was like a weird. Like I
Okay.
feeling a numbing on the
You
finger.
felt like a numbness? Okay. When was the last time that this happened?
Like in December.
In December?
It never happened before.
And after that hasn't happened again?
No.
Okay, it was painful, it was not?
No, no. Wasn't
It
pain.
was just numbness over there. Okay.
And then went away.
Okay. You feel you have leg cramps?
No.
No? Okay. So do you have any joint pain? At the moment you have problem moving your articulations?
No.
No? Do you have any limitation of movement on your body?
No.
Okay, very good. Have you have you passed out in the past?
Never.
Have you had any seizure in the past? No? Any history like involuntary movement of the hands or any part of your body? Any coordination problems that you're aware of?
No.
No tremors? Like, you know, when your hand is shaking? No? Okay. Do you have any history of anemia?
No.
Or like easily bruising, like, you know, when you touch something?
No.
No? Okay. Have you had any blood transfusion in the past?
No.
Okay. Do you feel like when you touch heat or something cold, you feel like intolerant to heat or cold? Or
No, not really.
no? Okay. You feel like you're having a lot of thirst? Like you need to drink too much water?
No, actually I don't
No?
know why.
Okay. Do you feel depressed?
No.
Do you feel with any anxiety?
No.
Okay. Any suicide attempt?
No.
Never? Okay. So that will be all for now. Thank you very much for your time and have a good day.
Okay, thank you. Lo que yo me